Hi, my name is Nick Eggleton, and today I will be talking about partial amputation versus below the knee amputation. While there has always been a conversation about the positives and negatives of partial foot amputation, also known as PFA, most of it has been built upon personal evidence provided by individuals and has led to a widely held belief that the possible harm caused by a PFA is worth it when considering the benefits. A PFA is intended to help the patient walk better, reduce energy spend, and improve one's quality of life. But when one takes into account that those people who generally undergo PFA are usually elderly and already have limited mobility, it raises the question of whether achieving the benefits of a PFA should be given priority over allowing the wound to heal and avoiding any possible complications and having to amputate again in the future. If further research reinforces what we see occurring in the evidence, then a case can be put forward towards selecting the amount of PFAs based more on the potential for allowing the wound to heal, rather than simply trying to balance that with functional improvements. This could potentially mean that transtibial, also known as below the knee amputation, is chosen more favourably due to the less risk of complication and little difference in the benefits it can offer compared to those who receive a PFA. Dillon and Fatoni argue that three beliefs integral to the use of PFA are built upon facts that are wrong and as such don't allow for a fully informed decision. Firstly, they state that it is widely reported that people with PFA have better function than those with below-the-knee amputation, due to the idea that maintaining the ankle joint and the residual foot length allows for push-off and an improved walking gait. Inquiries into this show, however, that only amputations away from joints that connect to the toes are able to use the ankle joint and calves during walking. Secondly, that the walking gait of those with a PFA expends less energy than those with a below-the-knee amputation. This idea stems from research showing a decreasing amount of oxygen coinciding with decreased levels of amputation. This idea is somewhat understandable, but the evidence available does not support it. It is predicted that oxygen cost simply reacts and changes to the pace of walking speed and intensity. Lastly, that a PFA gives a higher quality of life than a below-the-knee amputation. The ideas held about quality of life are usually based upon comments in literature that state that it is more efficient and less risky to walk short distances, for example, going to the toilet at night without a prosthetic. This research, however, does not describe, for example, that those with a higher amount of amputation may in fact be living without pain, which may be more desirable than simply finding it easier to walk to the bathroom without aid from a prosthetic. When taking into account the recent research, it's difficult not to doubt the assumed benefits of PFA and whether they are actually in fact worth trying to achieve, particularly given the risk of complication with it. While some may consider this risk legible due to the benefits, emerging studies show that benefits of PFA may not actually improve the outcome. As those who receive PFAs are usually older and unwell, as well as having little mobility, it does cast doubt whether these functional benefits are receiving too much importance over simply healing the wound. But while it is human nature to want to select the procedure that will maintain as much of the foot as possible, it is important to make sure the patients have all the information they need. As studies improve and we receive better information about the effects of amputation, we will continue to be better informed. Regardless of the high percentage of problems experienced by those with PFA, PFA is still preferred to below-the-knee amputation. The proclivity with PFA is based upon the belief that it will provide improved function, normal walking gait, lower energy spend, and an improved quality of life, despite studies which point out the opposite. It can be argued that we should adopt techniques that minimise the chance of needing a secondary amputation, in turn of trying to achieve the functional improvements of PFA which aren't well supported by studies. Overall, further research is required to better comprehend the positives and negatives of PFA to make this a more successful option. My name's Nick Eggleton again, and thanks for listening.